All right, so Scott, let's talk about eligibility. So eligibility for Medicare isn't as straightforward as some might think. Can you walk us through who qualifies for Medicare and when they should start the process?
Oh, absolutely. That's something that I get asked about at pretty much all of the educational meetings I put on. Really, there's three really parts as far as the eligibility. The one that everyone's most familiar with is turning age 65. Once you become age 65, if you at that point would be eligible to enroll in parts A and B, original Medicare that we talked about a second ago. You have 3 months prior to your birthday month that you turn 65. I'll give you an example. Somebody who's having a birthday September 4th of this year, they were born September 4th of 1960. So they'll turn 65 in the month of September. You're actually eligible for Medicare the first of the month that you turn age 65. So somebody born September 4th, their coverage would start September 1st. So they're allowed to enroll in original Medicare up to 3 months prior to that. So in the example I've given you, they could enroll anytime that summer, June, July, or August, for a September 1 effective date. They would still have the option to enroll in the month of September and up to 3 months beyond for your Medicare Parts A and B. So there's actually a 7-month window, 3 months before your birthday month that you turn 65, that birthday month, and then the 3 months after the month you turn 65. So that's the one that most people know about. That's the easiest one to explain. And that probably represents maybe 60% of the people out there. A couple of other examples. The second most one you see is people who have continued to work and they're on an employer-sponsored health insurance plan, and it's at a company that has more than 20 employees. It does require to be a company that large for someone to remain on their on their health insurance through work, even after they turn age 65. So if someone continues to work, they can stay on their major medical at work, and then they can wait till they retire. Let's say they wait till age 67. At 67, that would be a qualifying event. They would also have the opportunity at that time to enroll in Medicare A and B. Okay. Sometimes with an employer, if you keep your coverage, when you turn 65, the employer will ask you to enroll in Part A. That's fine, because in the vast majority of cases, Part A does not have a premium. It was earned. Anyone who worked for at least 10 years and paid into Social Security, they don't have to pay a premium for Part A. They've earned it. So if you're still working, your employer may ask you to enroll in Part A. You stay on the major medical. You wait till you retire. At that point, you would then get on Medicare. The third situation is where you see somebody who's been on Social Security disability for at least 24 months, then they're also eligible to enroll in Medicare. So I often see people who have on Medicare that are 40, 50 years old. I enrolled a young man this fall, was 31 years old, in a Medicare Advantage plan. He was on Medicare, and due to having been on Social Security disability for more than 24 months, applied for Medicare and had the coverage. So that's really that's your eligibility for Medicare.
Thanks for watching part 3 of our Medicare series. In part 4 of our Medicare series, we'll be answering what is a Medicare supplement. Don't miss it. Follow us for more Medicare insights.